Hi, my name is Catherine. I'm a registered nurse in the emergency department. I also have the role of ED champion for mental health. Some of the mental health interactions that we have are with some of our community's most valuable populations, whether it be anxiety, depression, substance abuse, or even an acute crisis. Therefore, we continually work on strengthening our response to these individuals, making sure that we are aligned with our I-CARE values with accountability and respect. So we're very grateful to have these community partners. They're often the first point of contact in the community with patients. And by the time they arrive to us, there's already a rapport built and there's valuable context already within that patient relationship. So in order to continue that collaboration in the emergency room, we share information, we coordinate care, and we make sure that the transition into hospital care is as smooth as possible. And this relationship helps us with planning patient discharges.
I'm Provincial Constable Claremont with the Nottawasaga OPP MCERT unit. I work hand in hand with a social worker.
My name is Sarah. I'm one of the crisis workers at the Nottawasaga OPP, and I have a background in social work. During a mental health call, I think our top priority is making them feel heard. Lots of listening, trying to understand their situation and what led up to this call, and identifying their needs, but also trying to identify their strengths in hopes that we can help them in the moment, but also try to connect them to services within the community that they may not know exist, and ultimately safety plan in hopes that we can leave them feeling better with a plan ahead.
SHIFT is a homelessness-focused support program that works with individuals that are experiencing the effects of poverty in South Simcoe. While we're not specifically a crisis response program or a mental health specific service, our role is to provide trauma-informed, client-centered care that helps people meet their basic needs, increase stability, and connect with the appropriate resources.
That the roles of each community player allows me as a nurse to ensure that I meet my patient where they are at in a more effective way, which ultimately improves the care that they receive. As we expand our hospitals, so are we trying to expand those relationships. We're looking to be more involved in community events, for example, such as the coldest night of the year that we participated in this year, which supported SHIFT, which is another one of our partners, which had immense success.
A team-based approach benefits the community because the more people we have involved in the conversation and working together to support our most vulnerable neighbors, the stronger and healthier the community. When different partners show up, we share knowledge and coordinate support, and people get what they need a lot faster, a lot smoother, and it creates a community where no one is left to navigate hardship alone, where everyone has a better chance at stability and belonging.
Mental health does not happen in one place or all at once. It's very much a continuum. And when we work together, we help reduce those gaps and improve safety for everyone. And it ensures that those without a voice have several avenues for advocacy.
Not to hesitate, we're here to help. Our goal is to make you feel safe, emotionally and physically.
The mental health crisis is just as real and just as urgent as a physical one. The Canadian Mental Health Association says that 1 in 5 people struggle with mental health. Personally, that 1 in 5 was my daughter, Mimi, who died by suicide in 2019. People are struggling, and often they've been struggling for a very, very long time, way before they came in through our doors. So unfortunately, mental health is still very much associated with a lot of stigma. Which is one of the leading reasons that people don't seek out medical care like they would, say, with a broken arm, the front, or a heart attack.
People can support someone they are worried about by checking in often with them, creating a safe space for them to feel open to talk without judgment, and letting them come up with a plan along with you in hopes that they can stay safe and be connected to proper supports within the community.
Don't wait until things feel unbearable or that you feel hopeless. We are all here to help. You do not have to go through this alone. We can also help guide you to resources that are appropriate for you.
So there are many community supports to reach out to, including Stevenson Memorial, calling the non-emergency line to speak with MCERT, SHIFT. Navigation can be confusing and it can be hard to take that first step, but there are many supports and people within the community that are truly hoping to help individuals. So don't hesitate to reach out.
In our line of work, I'd like to challenge that homelessness doesn't equal mental health concerns. We support a wide variety of individuals that are all experiencing individual situations, and that may be that undetermined life circumstances have happened, job loss, family breakdown, all of those things may be occurring and more. And the individuals are navigating the effects of systemic barriers and poverty, but homelessness does not equal mental health concerns.
You're not alone. You can call 911, you can call a non-emergency number. Request to speak to MCERT. We would be glad to come out.
What I would say to someone struggling is that you don't have to walk the hardships alone. There are people and programs that are ready to walk alongside of you. Support and compassion exists.
I would tell you that if you are thinking about getting help, that's your sign to reach out to us.